This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, December 2nd, and I'm Zach Caruso. Our lead story this week is in drug and alcohol dependence and is titled Very Low Nicotine Content Cigarettes for Smoking Cessation, Examining a Facilitated Extinction Approach and Dosing Schedule. Very low nicotine cigarettes, or VLNC, have been shown to reduce smoking behavior when compared to normal nicotine cigarettes. Participants were randomly assigned to 4 experimental groups: immediate versus gradual transition to VLNC, and standard counseling versus facilitated extinction counseling. Facilitated extinction had involved participants smoke only in relevant contexts. The immediate nicotine reduction group reported less smoking satisfaction and lower completion rate. Abstinence at 2 months post-study was 29%. There were no significant differences between the 4 study groups. VLNC were beneficial in smoking cessation. Next is an article in Alcohol Clinical and Experimental Research titled Contingency Management for Unhealthy Alcohol Use, a Systematic Review and Meta-Analysis. Studies have demonstrated the effectiveness of contingency management, or CM, for AUD. However, there's limited evidence for unhealthy alcohol use, or UAU. The systematic review and meta-analysis assessed the evidence for CM in UAU. Of the studies meeting inclusion criteria, 21 were randomized controlled trials. Weekly contingency reward values range from $12.80 to $116, with 4 studies using rewards other than money. Studies measuring alcohol-free days showed a significant increase with CM. Studies measuring negative alcohol samples also showed significant increases for those with UAU and not AUD, as well as those with AUD. Some studies also showed decreases in cigarette and stimulant use. Those measuring cannabis use found no significant effect. In individuals with UAU, CM reduces alcohol use. Our next article is in the American Journal of Psychiatry and is titled Acute Effects of Cannabis on Alcohol Craving and Consumption, a Randomized Controlled Crossover Trial. Among individuals who engaged in regular cannabis use and heavy episodic drinking, smoking cannabis acutely reduced subsequent alcohol consumption. In a double-blind crossover randomized controlled clinical trial with 138 healthy adults, cannabis containing 3.1% and 7.2% delta-9 THC compared to placebo cannabis acutely decreased alcohol consumption on an alcohol choice task. While cannabis smoking did not significantly change cue-induced alcohol craving, 7.2% THC dose significantly reduced alcohol urge relative to placebo immediately post-smoking. Next is an article in JAMA Health Forum and is titled Trends in Methadone Use for Pain and Opioid Use Disorder Among Medicaid Enrollees. This research letter used a 100% data set from the Centers for Medicare and Medicaid Services to evaluate the number of patients receiving methadone or buprenorphine for opioid use disorder among adult Medicaid enrollees from 1999 to 2020. Data represented Medicaid enrollees in all 50 states, Washington, D.C., Puerto Rico, and the Virgin Islands. Dual Medicare and Medicaid enrollees were excluded. There were modest increases in methadone and buprenorphine use from 1999 to 2010. From 2010 to 2020, use of both methadone and buprenorphine increased, with buprenorphine use increasing substantially more than methadone use. Also from 2010 to 2020, use of methadone for pain declined. Next is an article in the American Journal of Psychiatry titled Inner-Directed Therapy in MDMA-Assisted Psychotherapy. MDMA has been proposed to assist with therapy for post-traumatic stress disorder, or PTSD. 2 phase 3 trials have been conducted with MDMA-assisted therapy, but the FDA rejected the new drug application and requested additional details. While they did not provide guidance for future studies, the authors of this commentary discuss some of the potential issues with prior trials that used inner-directed therapy, or IDT. The authors do note the promise of MDMA-assisted therapy and support additional studies with MDMA-assisted IDT. They also support additional MDMA-assisted therapy trials using alternative therapy modalities to best understand the efficacy of such treatment. Our final article is in JAMA Network Open and is titled Perceived Harm of Snus and Smokeless Tobacco Among U.S. Adults. While snus and smokeless tobacco do cause harm, they are less harmful than cigarettes. Researchers used data from the Population Assessment of Tobacco and Health Study to assess if the U.S. adult population were aware of this difference in harm. Overall, only a small proportion of the population was aware that snus and smokeless tobacco were less harmful. Among those who used snus or smokeless tobacco, a larger proportion noted they were of less harm. The authors note that given the perception that snus and smokeless tobacco cause equal harm, those who use these products may be more likely to initiate smoking, and those who smoke may not view these products as less harmful alternatives. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.